The outbreak of the Marburg virus in Rwanda is a stark reminder of the deadly consequences that arise when human activity collides with nature in uncontrolled ways. Deep within a tin mine near Kigali, where thousands of bats have made their home, workers unknowingly expose themselves to one of the deadliest pathogens known to science. Despite clear scientific warnings about the risks of zoonotic spillover, where viruses jump from animals to humans, economic pressures and a relentless drive for resource extraction have created conditions where outbreaks like these are no longer isolated incidents, but part of a disturbing pattern. The mine's tunnel number 12, where an estimated 10,000 bats roost during the day before emerging at dusk, became the epicenter of the outbreak. The first known case, a woman who succumbed to the disease, was infected by her husband, a miner who had unknowingly carried the virus after working in direct proximity to the bat colony. By the time the outbreak was officially declared on September 27th, 66 people had already been infected, 15 of whom did not survive. The fact that the virus spread among healthcare workers before authorities could identify its source highlights the persistent vulnerabilities in outbreak response, even in a world that has faced multiple deadly pandemics in recent years. Marburg virus, a close relative of Ebola, is notorious for its high fatality rate, which can reach up to 88% depending on the outbreak. The World Health Organization estimates that the current average mortality rate is 50%, meaning that once an individual is infected, their chances of survival are no better than a coin toss. The virus spreads through contact with bodily fluids such as saliva, blood, and feces, making it highly transmissible in healthcare settings and among close family members. Adding to the difficulty of containment is the fact that infected individuals may not show symptoms for up to 48 hours, providing a dangerous window in which they can unknowingly pass the virus to others. This outbreak in Rwanda is not an isolated event. It is part of a larger, more troubling trend. The number of Marburg virus outbreaks has been rising steadily over the past 2 decades, with clear links to the expansion of mining operations across East and Central Africa. The pursuit of valuable minerals such as tin, gold, copper, and coltan has led to increased deforestation and deeper excavation into regions where bat colonies have existed undisturbed for centuries. As mining tunnels extend into bat habitats, the likelihood of viral spillover grows exponentially. The past 5 years alone have seen more Marburg virus outbreaks than the entire decade of the 2000s, a correlation that cannot be ignored. Despite the immediate danger posed by the virus, there was never serious consideration of shutting down the mine. Economic interests took precedence over public health, and instead of halting operations, authorities merely redirected mining activities to another section of the hill. A perimeter was set up around Tunnel 12 to prevent further human contact with the bats, but experts warn that this is only a temporary solution. Bats are highly mobile creatures, capable of traveling up to 7 kilometers in a single night, meaning that even with monitoring programs in place, the risk of further spillover remains dangerously high. The lack of an approved vaccine or antiviral treatment for Marburg virus means that outbreaks like these continue to rely on containment strategies rather than true medical solutions. Experimental treatments exist, but they are still in the early stages of testing, and their availability is limited. In the meantime, governments and mining companies are forced to improvise, implementing basic infection control measures that may slow the spread but do little to prevent future outbreaks. The reality is that the world is failing to address the root causes of these outbreaks. The relentless push for mineral extraction, often in politically unstable regions, is creating a perfect storm for viral transmission. The mining sector, driven by global demand for raw materials, has little incentive to slow down or invest in comprehensive safety measures. Meanwhile, affected communities, many of whom rely on these mines for their livelihoods, have few alternatives, making them reluctant to demand stricter regulations that could put their jobs at risk. The situation in Rwanda is a warning that cannot be ignored. As long as human encroachment into wildlife habitats continues unchecked, The risk of new and potentially even more dangerous viruses emerging remains ever present. The lesson of Marburg is not just about the devastating toll of this particular outbreak. It is about recognizing that the conditions that gave rise to it are being repeated across the world. Unless there is a fundamental shift in how we approach the intersection of economic development and public health, we are not just facing another outbreak. We are inviting the next pandemic.